Hi, and welcome to the Daily Mix. I am your host, Connie Wrye. All of us want to look our very best as we age, and today we're here at Wrye Plastic Surgeons. We're here with Dr. Wesley Hall. He is a board-certified plastic surgeon. He is also the co-founder of Wrye Plastic Surgeons. When we want to look our best, what are the options to do so? We're here with Dr. Hall to talk about something really beautiful, an amazing procedure that is really giving that youthful glow and giving the lift to the eyes. It's the Bleph. Can you explain to us, Dr. Hall, a little bit about what this procedure is?
Yeah, people call a Bleph. That's short for blepharoplasty, which is obviously just the Latin term for an eyelid fix. That's all it is. So we're talking about fixing the eyelids. Many people who will notice as they're looking in the mirror as they get older, they say, where did all this extra skin come from on my eyelids? I know that when we're younger, we see things looking one way, but this particularly as we age, we might see skin that's excessive on the upper eyelids and potentially on the lower eyelids as well. Two different operations, but a blepharoplasty or an eyelid lift is actually a pretty easy operation that can rejuvenate the eyelids, taking away extra skin and maybe some extra fat that's there as well.
Who is a candidate for this procedure?
Well, anybody who might think that their eyelids are looking different than they used to when they were younger. Obviously, if we're going to be doing surgery on somebody, they need to be in good health. We're not going to be doing anything that's dangerous. We're not going to be doing anything on somebody who may not be a candidate for any kind of surgery. But this is actually a pretty easy operation. It has minimal downtime. I tell patients they might have bruising potentially for a week or two, depending on how they bruise, depending on medications that they might be on. But in terms of pain and recovery, getting back to normal activities, that's usually within days.
Wow, that's amazing.
Yeah, so you're having surgery and you're back to normal activities pretty darn quickly.
Is this a procedure that you can come in and do in your office, or is an actual surgical procedure?
Yeah, I like to say minor surgery on somebody else. When it's on you, it's a big deal. Some patients are feeling pretty good about being awake, and we can do this frequently under a local anesthesia. So we might be able to do it right here with just giving some numbing medicine. A lot of patients do not want to be awake. They do not want to be feeling anything. And for those patients, definitely go to the operating room, which is very, very easy. But it can be done either way depending on the patient.
And for those individuals who are looking at this procedure, this is also an option for men and women, is that correct?
Absolutely. Yeah, lots of men will notice this occurring as well. So it's not something that is peculiar just to women. One thing we do want to do is we want to still maintain our own countenance, our own face. We're not here to try to change the way somebody looks. It's just to take away the extra that we may accumulate as the years get older.
Right. Just keeping that young, fresh look that we have known and loved for so long. We want to continue that glow. What about insurance options? Is this something that you could get through your insurance?
So, yeah, that's a question frequently asked. There are people who have significant excess skin around their eyelids that is something that is actually blocking their visual fields. So they're not seeing as well because of extra skin. In such cases, insurance may cover that. That's not necessarily a cosmetic operation. That's an operation to actually improve your vision. So that's a reconstructive procedure. That usually needs to be seen by your eye doctor, which can occur, but you're absolutely right. There are cases where somebody is going to say, I'm going to have this operation and my insurance is actually covering this. There may be a benefit to an aesthetic goal, but the primary reason in such case is to improve their visual fields.
And look fantastic. That's what you're doing, giving them back the radiance that they had before.
That's the goal of this operation when we're doing it for cosmetic reasons, absolutely.
Well, you can learn more about the procedure by visiting their website. You can also follow Wrye on their social media and find more information right here on the Daily Mix.